So before I take a moment to introduce our great keynote speaker, I want to first take a moment to thank the incredible sponsors who have made today possible. Their support reflects a shared commitment to improving maternal and child health and advancing equity across Broward County and beyond. First, thank you to our gold sponsors: Memorial Healthcare System, Children's Services Council, Health Foundation of South Florida. Our Hope Builder sponsors: Community Care Plan, HCA Florida Healthcare, Humana, Sunshine Health, Cloud9 Nonprofit Advisors, United Way of Broward County. There. Thank you to HRSA for your keynote sponsor. Thank you to our Wellness Warrior sponsored Broward Health. Thank you to our Nurture Navigator sponsors, South Florida Wellness Network and Heme On Call. We give thanks for our Hopeful Beginning sponsors, Dex Imaging, Early Learning Coalition of Broward County, Brown & Brown, Charlie Health, and the Journey Institute. Let's give a warm round of applause for all of the generous sponsors, and we thank you for your partnership and dedication to this work. It is now my honor to introduce today's keynote. Before I do that, I would like to remind you to silence your phones so that we can hear her words clearly. Chanel Porchia-Albert is a nationally respected health policy advocate, doula, and founder of Ancient Song. Her work bridges policy and practice, ensuring communities of color receive respectful, equitable care during pregnancy and beyond. She's advised everyone, from city leaders to federal policymakers, and she co-created the Baby Dove Black Birth Equity Fund. Her story and her mission remind us why we are here today. It is really a personal pleasure of mine to bring Chanel to the stage because I have watched her organization in parallel with my work, just watched her grow and shine and grow and shine and grow and shine over the past 10, 15 years. And so I would like to welcome to the stage, introduce to some and present to others, Ms. Chanel Porchia-Albert.
Good morning. Good morning. All right, that sounds a little bit better. You all look beautiful this morning. Let's see how this works. I'm already going too fast. No? Here we go. So we are healing legacies and we are shaping futures. Again, my name is Chanel Porchia-Albert. I would be remiss if I didn't start out by saying that my work is grounded in my children. One of my children is sitting here in the audience today. Yes, give her a round of applause. I am a mother of 6 beautiful children. I have a 16-year-old son. I have 15-year-old identical twin daughters. I have a 14-year-old daughter who's here. I have a 8-year-old daughter and a 7-year-old son. And I honor them first because they are the catalyst for me being and getting into maternal health work. If it wasn't for my first birth, where I had a wonderful home birth midwife, I had a doula, I had care that was centered on what it meant for me coming into parenthood as a mother without a mother. Having that support, having that guidance, having someone to hold my hand, having someone to answer my questions and my husband's questions, really was the precipice for me saying, okay, I want to be a doula. Right, I want to be able to show up for people, and what does that look like? What does it mean for us to center one another, right? To have conversations where we're not just listening to respond, but we're listening to hear. right? We're listening to truly understand where someone is coming from and their unique perspective on what it means to shape their parenthood. And so that work has, always been the foundation. So I took a doula training when I literally was 7 weeks postpartum. Yes, I was 7 weeks. I had a child strapped to my chest. I was breastfeeding. I was surrounded by a community of healers, of midwives, of doulas, of folks who were from around the world, who had all gravitated in Harlem, New York. So if anybody knows about Harlem, yeah, all right. How many people know about Harlem? Okay. So if you know about Harlem, then you know that Harlem is the mecca of all things, right? It is the mecca of, especially when I was growing up, lectures, of education, of culture, right? It is the grounding and foundation of various different movements throughout this nation that have really been a catalyst for change. So me coming into a space as a mother, surrounded by mothers, surrounded by healers, surrounded by community members who are all centered on offering their perspective and their knowledge and their wisdom about care. And that was the first time I had ever been held as a mother. You know what it's like for somebody to just grab your child up and be like, girl, give me that child. You all right? All right? And just hold your child. Because, we're a little, first time moms, you're like, I don't know if you should be touching my child, right? But in that one space, that was a space where I was really I felt like I was seen. I felt like I was held, right? And after I took that training, we literally marched down 125th Street in a walk for maternal mortality. And this was back in 2008. And so since 2008, we have been having this same conversation. And even prior to 2008, we have been having this same conversation around what does it mean for us to center the voices of Black, brown, and indigenous people? What does it mean for us to offer culturally responsive and culturally humble care? And what does it mean for us as a larger ecosystem and community to show up for people as our best selves? Understanding the roadblocks that may be set in place. Understanding what it means that we are not separate of, but we are a part of. A bigger conversation that is really grounded in, essentially, people want to be seen. People want to be heard and they want to be valued. They want to know that someone genuinely and truly cares. When I walked into the room this morning, I was kind of struck, I was taken aback actually when I saw the numbers on the screen. And I was like, wow, that's kind of an interesting way to walk into a conference about healing legacies and shaping futures, because it started with numbers. And the numbers that I saw on the screen were drastic. And so if I'm sitting in the crowd and I'm watching this and I'm seeing images of numbers around Black and Haitian and Hispanic individuals, and it says that I, me, myself, who is not separate from community because I probably am part of that community in one way or another, what does that mean about my people? What does that mean about my community? Does that mean that we inherently don't know how to give birth? Does that mean that we inherently are not showing up for something? Like, what are the numbers really showing us? What is the narrative behind the numbers? Then I'm wondering, too, how is that feeling in your system and in your body? How are you, as caregivers, holding on to that? Because you, too, are not separate from. You are in the trenches every single day showing up for people while also trying to show up for yourself. You are mothers, you are fathers, you are aunties, you are somebody's cousin, you're somebody's sister. You too may be pregnant and or parenting or maybe thinking about being pregnant. If I saw that, would I be wanting to become pregnant? Or would I question myself and say, wow, I don't necessarily know if I'm going to have the support that I need to really move forward in that care. And so I wanted us to take a moment to take a collective breath. Right? One, for you to acknowledge yourselves and your spirit. an opportunity for you to acknowledge your own breath and that you are not separate from the work that you do. And so I'm going to ask you to stand. And if you want, relax your arms. Y'all are like, come on now. This is not, we're not in school. You're like, I am studious, I'm ready. Yeah, relax yourself. Roll your shoulders, feel your body. Some of you are probably rushing here this morning. Some of you have been here since the crack of dawn. Like, child, I gotta make sure this is right. I don't want to get fired. I do want to thank the folks, my hosts, though, especially Samantha. Samantha, could we give Samantha a round of applause? Samantha has been incredible, and I have to say this, like, she has, you know how you get somebody and they just responsive, like they just on it? I need a Samantha at my office. I'm like, can I transport you to New York, please? But yes, the way in which Samantha helped me. I text her on a Sunday. Like, that's against people's religion to text somebody on a Sunday. I grew up in a household where you didn't call people after 7 o'clock because that was a sin. So yes, relax your body. Roll your neck, roll your shoulders. Take a nice deep breath in. Acknowledge yourself. Acknowledge your presence, your being. You woke up this morning. Child, you woke up this morning. Okay, you woke up this morning. Yeah. With everything that's going on in this world, I think sometimes we forget the little things. And waking up is not a little thing, right? Being able to interface with people, being able to say hello, being able to acknowledge someone's humanness, right? To say, hey, I see you, right? That's important. That means that you got the blessing of life this morning, right? Even though, you may have trials and tribulations throughout the day, that's okay, because that means I'm alive. I'm able to experience and to feel, all right? So I want you to take a nice deep breath in again and slowly exhale. One more time, nice deep breath in, slowly exhale. And then you're going to repeat after me. I am here. I am here. I am here. Nah, I don't believe y'all. Not feeling it yet. I know y'all had a little bit of croissants. I know you had some muffins. I need to feel it. I am here. I am here. I am here. Honor your presence, honor your being, honor the fact that you woke up this morning. Honor the fact that you are able to do this work. Honor the fact that you are able to stand in your purpose of sharing and giving to others. And say, I am here. 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 Listen, the people in the casino can't hear you yet. They don't understand. I was walking through it and I was like, Lord have mercy. There's a lot going on in here. And my daughter was walking with me and she said, this is really colorful. I was like, yeah, it's an adult arcade on steroids. I was like, don't get trapped in the pitfalls. It's really just to suck your lifeblood. Repeat after me one more time. I am here. 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 Now take a deep breath in and slowly exhale. One more time, deep breath in and slowly exhale. And give thanks for your life. You may have a seat. So as you are honoring yourselves, now I got y'all too hyped. As you are honoring yourselves, what you are doing is you're taking an opportunity to honor your collective roots. You're celebrating traditions as caregivers, because every person in this room is a caregiver. At one point or another, you are either caring for yourself, you're caring for a family member, you're caring for your community members, you're caring for your coworker. We're oftentimes checking in, being like, how you doing, girl? Them people ain't getting on your nerve, are they? Y'all know how it is. You are honoring and celebrating our collective role as doulas, as midwives, as community health workers, as connectors. You are a connector. What does it mean for us to be a connector? Right? We all have that one person in our family, that one person who has always got all the info. They got the down low on everything. They're telling you the ins and outs of where to go, who to be, how to get connected to them. And you all, as you sit here, you are also those people. You are the individuals who are helping people to navigate resources, to understand what is safe and what is not safe, to understand what it means for you to be able to shape the legacies of others. You are using your intergenerational wisdom as a foundation to create innovation in care, which means that you all are innovators. I don't know if did you think about yourself like that when you woke up this morning? Right? Did you say, yes, I'm an innovator? Right? I'm sitting here and I am creating space, I am making space, I am moving mountains. And a lot of you are doing that with next to nothing. Some of you may be doing that without the support of your coworkers. Some of you may have abundance of support. But you are innovating and creating the new pathways for change and for hope. So where we are today may seem a little, I don't even know what to call it. Every time I turn around, I'm like, am I in an SNL skit or? I'm like highly confused because I'm like, make it make sense. You know, it's like, I've noticed that we live in a world where people talk out of both sides of their mouth. You ever heard that saying? Child. You know exactly what I mean. We saying one thing and we're doing something else. And so given this ever-evolving and changing landscape, right, we need responsive, supportive, and respectful care for families. And I was going to dwell on the numbers, but I'm not, because you all have already seen them, and you already know what the numbers are, because you do this work every single day. You're in the trenches every single day. You're showing up for people every single day. And with the numbers of 22,000 births in one county, Lord have mercy. Y'all are busy. Like there's somebody giving birth right now. Like you just took a bite of your croissant and somebody just pushed out a baby. I said, wow, Broader County, all right. Y'all may need some extracurricular activities. I got 6 kids and y'all are doing more than me. Right? And so in understanding that we have an ever-evolving landscape, understanding the numbers, right? And the numbers may put us in a chokehold, may make us feel like, am I truly making a difference in the work that I am doing? And it may make us question our abilities, right? Is the work that I'm doing every single day when I get up and I get myself together and I put on my shield, I put on my armor, right? My armor, my protection. Am I really, truly making a difference in someone's life? And I want to tell you that you are. If you are doubting yourself and you are questioning yourself, I want to tell you that you are. I want to tell you that every time, again, and I can't emphasize this enough, that you show up every single day, you are making a difference. You are changing the lives of others, right? And one of the things about Ancient Song, when I first started it, and it started in my home, literally. I became a doula, as I told you, and I started to attend births. And when I did that, I was doing it for free. I had no intention on making any money. I just really wanted to be able to help. And so I opened up my home, and my beautiful husband, he said, I got to mention him, because if it wasn't for him holding down the fort, none of this, I wouldn't be able to stand here right now. So give it up to your partners. And he's watching the 5 kids right now. He called me this morning, and he goes, "This morning routine is I said, "I know. Welcome to my world." But yeah, so Ancient Song, it started in my house, and it started with me opening up my home. And I literally wanted to listen to people's stories. I had started to attend births, and I saw the ways in which birth became a site of criminalization. When I got into birth work, I was very naive. Naive in the sense that I lived in this world where I thought that birth was free of racism and discrimination. Because I'm like, it's birth. Like, birth is birth. Like, this is the one sacred moment in someone's life where life is coming into this world. And I really was in a space of disbelief when I saw the ways in which people were being profiled, how folks who were on Medicaid were treated, how safety net hospitals were profiling individuals and putting their children on hold. I was taken aback when I went and supported folks at prenatal appointments. And I would see how someone was on Medicaid, and they would sit for 3 to 4 hours to be seen for 15 minutes, only to come out, go into their visit, and all of the information be directed at me. And I'm not even the person that's gestating. Right? To have for me to be like, actually, that's the person who you need to speak to. I'm just a doula. To see individuals not have their cultural and religious beliefs respected, to see their voices be and go unheard, I was like, how is this even humanly possible? To see illegal drug testing without consent. To see, like, true informed consent not happening. To see the ways in which Black fathers were dismissed in the birthing room as either being seen as aggressive or why are you here? To see security guards be called on people for asking questions. To see the ways in which when someone was advocating for themselves, their voice not be heard. To see the way we, as healthcare providers, will preach to the choir about collaborative care frameworks and it fall on deaf ears in reality. And so I opened up my home, and I cooked for people, and I made food, and I listened to their stories, and I put a call out on a listserv, and I said, who else wants to support low-income people within the community? And about 23 people showed up at my house. And that is how Ancient Song got started. It got started from seeing a problem and doing something about it. I didn't have not one red cent to my name. I had no idea how I was going to help people, but I knew that we had to do something. I knew that voices were going and being dismissed every single day. I knew that people were hungry, and I was like, if I have food that I can share, I can feed them. Right? And so we went on to then get an office, and our first office was a closet space, like, the size of somebody's walk-in closet. Child, we was tight. I was like, this is like a cozy uterus. We just all warm and bubbly together. And so now we're at a space where we have 2 locations in 2 different states. We went from being in a home to being a national model to having community-based doula programs within hospital-based institutions to going on. Thank you. To going on to shape and inform city, state, and federal legislative policy around reproductive health. And to really showing what it really means to not just talk about collaborative care, but put collaborative care into action, right? And understanding that it can't just be all on the patient. It's not just about the education of the patient, but it's also as a provider, are you being supported? We forget about providers. We forget about ourselves all the time. We give people education till they blue in the face. Eat healthy. Go to prenatal yoga, right? Here's a censoring program. Here's this program. Here's a lactation program. Here's all of the things. But how are we ourselves centering ourselves? And how can we collectively center other people if we haven't taken an opportunity to see ourselves in the framework of this? To the point where we oftentimes will get burnt out and say, I don't want to do this no more. I'm finished. I'm done. I'm throwing my hands up. And without us taking the opportunity to really see each other, to understand our connection to one another, we're not really truly solving the problem. We will never truly solve the problem. There is strength through service. There is strength through education. There is strength through innovation, but there is also strength in collective care. And if we don't take the opportunity to care for one another, we're not going to be able to do any of this work. We have to look at innovative models. One of the other things that we were able to do, myself and one of my long-term partners, M.A. Brill, was start Just Birth Space, or what we call JBS. And Just Birth Space is a virtual telehealth space. It's national. Anybody could tap in. So that providers could have another way, another tool to be able to connect their themselves and or their community with another resource. Somebody can text in real time and get support during pregnancy, childbirth. They can ask questions around policies. We partner with community-based organizations in various different states to be able to offer on-the-ground support as well. We're a team of trained doulas that provide compassionate, culturally aware care. And we're meeting people where they are, physically, emotionally, and logistically, right? We're creating a safe space for questions in different languages. We're honoring someone's culture on a virtual platform. And so we have text. You can text in. You can ask a question. If there's something that's going on that it needs to be elevated, they can do a virtual one-on-one where you can see someone's face. And then we have community connect classes. In these classes, people can drop in into as many as they want to, as many times as they want to, and guess what? The platform is free. And it will always be free. Yes. So now you all got a new tool to use to put in your tool belt. So you're going to look up Just Birth Space. You're going to be like, yes, I can use this. Because we understand that you all can't always be touch points all the time. Right? So how about having an extended touch point somewhere else? And as a doula, how many doulas are in the room? Ooh. Okay. All right. How many community health workers are in the room? Y'all sound, hold on. Didn't we just talk about honoring ourselves? And the work that we do? How many doulas in the room? That's a lot better. How many community health workers in the room? How many lactation consultants in the room? Okay, how many coordinators in the room? How many people doing community outreach in this room? Okay, yes, come on now. Y'all better, come on now. You better get it together. So as doulas, as community health workers, as innovators and connectors, we're trusted companions. We offer that emotional support, right? We're offering physical comfort. We're encouraging and navigating healthcare settings, and we're using research-backed outcomes. We're using community-based models of care. So that means that we are not just in a community, but we are extensions of community. I'm gonna say that, let's just say that. Let's say it together. I am not just in a community, I'm an extension of that community. Okay, I am not just in that community, I'm an extension of that community. Exactly, because these are the people that you see every day. At the food store, maybe at the casino. Right? We're seeing them when we go to the doctors, when we go shopping, when we go to the mall. Right? We are not separate from, we're a part of when we go to cultural events during the summertime at the beach. Y'all got the summer and the beach. Oh my goodness. I'm jealous. New York beaches is not like y'all beaches. Your water is clear. Our water is the color of this desk. Right? And so as you are doing your work, as we're serving through a shifting landscape, we want to acknowledge today's rapidly changing healthcare system. We want to acknowledge that, I see people's faces like, yeah, child. We don't know what's going to happen in the next 5 minutes. It's funny, but it's not funny. You know, it makes me think about history. It really makes me think about, everything happens in a circle and in a cycle. And we are not experiencing anything new. Did you hear what I just said? We are not experiencing anything new. It's just a playbook of 2.0. And so in acknowledging that playbook, it's really important for us to reach back and to speak to our elders. It's really important for us to reach back and speak to the people who have been grounded in this work for a long time. It's really important for us to reach back and have tough conversations, right? To understand that there may be resource limitations, there may be workforce challenges, and growing community needs, because there are. People are afraid to go to their prenatal appointments. Let's be real. People are afraid to go to their prenatal appointments. People don't have access to safety net programs because every 5 minutes they're closing. In one breath you're saying this resource is available, and in the next breath you're saying, wait a minute, I'm sorry I gave that to you, it's not available. And so you are fighting an uphill battle. And what that really means is that you all need to de-silo your work. I'm going to say that again. You have to de-silo your work. Now is not the time to try to do all of the things. Now is the time where you double down. Now is the time where you think about the roots of the work that you know how to do and do it well. You don't have to try to create a new program. People don't need a new initiative. We don't need a new coalition. We don't need a new task force. Child, Lord have mercy. You know, some stuff can be an email. Now is the time to think about the things that we have and to strengthen our collective resolve. Now is the time to reach out to community-based organizations that you have that maybe you don't have the best relationship with. I'm going to say that again. Now is the time for you to reach out to community-based organizations that maybe historically you haven't had the best relationship with. It is not about our politics. This is about our collective humanity. There is a concerted effort to dehumanize all of us, for us to get to the most wretched parts of ourselves. When someone can tap into that part of you that even you don't like about yourself, then they can easily control a narrative. If I can get you to other people every time you turn around, them people over there, oh, well, you know how they are. Oh, well, they don't show up for care. Oh, well, they're too loud. Oh, well, they do the most. Hello. You know exactly what I'm talking about. Now is the time for this is not it. Now is the time to de-silo the work. Now is the time to build bridges, to have tough conversations, to reconcile, to think about the ways in which we can connect with one another. Think about where our strengths are at. If you know that you're good in connecting people and bridging resources, then get to the community-based organization that is trusted by the community members so that they can pull them in. If you know that you can't do one specific job, but your partner or across the street can do that job, pull them in. If you know it's the church, pull them in. If it's the barber shop, pull them in. If it's the child care center, pull them in. If it is the food pantry, pull them in. If it's the casino, pull them in. Everybody has a stake in the community. We are not separate of. And this is how we're able to stay adaptable, collaborative, and deeply committed to care. Truly. I'm not talking about the theoretical stuff. I've been doing this work for a very long time, and a lot of it is just people talking. I'm just going to be real. A lot of it is just like, everybody got a theory. Everybody's got a new something. Child, everybody got a theory. Everybody got a model. We're going to try this new model. Why? Your staff is like, why? Didn't we just start a new model yesterday? You laughing because you know I'm telling the truth. Y'all don't have the space to say it, so I'll say it for you. Now is the time for leaders within your organization for you to ask your staff, what are their skills? What's your skill set? What are your ideas around how we should address the problem? We can't just think that we as leaders just have all of the answers. Let me just say that again. We cannot just say that we as leaders have all of the answers. No, I never attest to that. I ask my staff every day, child, am I doing this right? Check me if I'm wrong. Ask them, how is this serving you? What do you need so that you can show up to your job every day? Because let me just be clear. All of the things that are happening in the world are also happening to the people that you work with every single day too. Grocery prices is high. I need a farm. These 6 kids is wearing me out. Right? You know when your parents back in the day used to be like, you're eating me out of house and home. Like literally. Right? So like, how are we creating mutual aid for each other? How are we centering one another? Like, listen, we have the annual potluck. Now, some of y'all, I'm gonna need y'all to be careful about what you bring. But like, what about doing that on a weekly basis? Right? What does it mean for us to care and share with one another? Not just a community, because oftentimes we feel like it's separate from us when we are doing a programming for community. They're like, well, that don't got nothing to do with me because I'm not accessing that program. Child, that got everything to do with you because you 2 seconds away from being in the program too. Let's have real talk. And if this landscape keeps going the way it is, we all about to be in the program. So it means that we have to be very intentional about de-siloing. And what care actually looks like is respectful. It honors each other and family in our unique journey. It's centering compassion, communication, and trust. Right? We're not talking out both sides of our mouth. We're looking and leaning into holistic models of support, mental, physical, and emotional well-being. Again, not just for the people that you're working with, but for your staff. We need therapists too. We need a group that doesn't have us in it as leaders. No, you can't have admin in it because then they can't really tell you about how you like doing the most and not doing nothing. Because then they're not going to really share. They need something like off-site, right? But they need those things. We need moments for like a massage, mental health day, right? I tell my staff sometimes, you just went to a birth, I don't want to see you the next day. Oh, here's a gift certificate to community acupuncture. Yeah, child, that's what I do. If I'm going to go and get a massage, why shouldn't you get a massage? Right? We're creating spaces where families are seen, they're heard, and supported. You need to be seen, heard, and supported. Right? And there's strength in that community. Again, there is mutual support, shared knowledge, and collective wisdom. We're de-siloing the work. We're celebrating ourselves as local champions and community health workers. Everybody in here is a community health worker, even if you didn't acknowledge yourself as one. Let me just say that. You work in community. You are a community health worker. You are a caregiver. You're a service provider. You're in the business and being of service to other people. You realize that, right? So whether you are doing data, whether you are a researcher, whether you are the person who answers the phones, whether you're the person who is at the block parties, whether you're the person who is sitting at the front desk, whether you're the administrator, the leader, like all of us are service providers. All of us are community health workers. All of us are caregivers. And so when our resources are stretched, this is our opportunity to come together, for us to really de-silo and to work cross-sectional. To have moments where we're working with medical providers, public health, grassroots organizations, and policymakers. It's important. I know some of y'all like, I don't want to get into all that policy stuff. Listen, if you ain't there, then people do what they want to do. You got to have the conversation. You got to show up. Moving forward together, we're investing in workforce development. We're strengthening our referrals and our continuity of care. 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 It ain't just the little continuity of care. I tell people all the time, postpartum is forever. Postpartum is forever. As a mother of 6 children, I've learned that from experience. Right? So which means that if postpartum is forever, we need to continue to show up for people, not just in the beginning stages of parenting, but as parenting goes on. Even into perimenopause, because child, I'm over here having a hot flash right now. Lord knows. We need to elevate family voices and designing services. So we're using community as stakeholders. Let's not just build programs because we see it from our perspective. It's important that we set up community advisory boards. It's important that we have community stakeholders who are acting as feedback loops to tell us, like, no, actually, I don't think that's going to work. Where we're checking in with them on a consistent basis, where they're valued voices within our communities. If we don't do that, then who are we really doing a program for? Is it for our own ego? Like, we need to be, in order to be in a community, to be an extension of the community, and then you have to have community there, not just to provide the programming, but to give voice to that around what's working and what's not. And we build those partnerships to sustain families and providers. I'm going to say that again. To sustain families and providers. Providers, you all together. And this is how we create a vision for the future. A vision where we're thriving, right? Where we are prioritizing dignity and wellness. We're having healthy beginnings and sustainable futures. We're going to keep showing up, we're going to keep connecting, and we're going to keep building. Because it's important. Because it's our duty as human beings. I'm going to say that again. Because it's our duty as human beings. Again, we live in a society that wants to other us. We live in a society that wants to see us different from the people that we're sitting with at the table. Like, I'm a vegan. I'm like, I see you over there eating that steak. No, eat your steak. Because I got my cauliflower steak right here too. Right? We're honoring each other. We're respecting each other. We're embracing each other. We're learning from one another. We're humble in our approach. Did you hear what I just said? We're humble in our approach. And that is how we're able to keep building. That is how we're able to keep showing up, especially when it's hard. Because right now it's a little difficult. It is. The reality is what it is. But we have to keep hope present because people are depending on us. We're depending on ourselves and each other. And without that hope, then everything just goes disarray. I want to thank you for the opportunity to be here today, to be able to show up, to be able to present. I hope that you have had an opportunity to learn something, and I hope that we can continue to grow and collaborate together. Have a great day. Thank you. Thank you. Thank you. Thank you very much. Thank you.
Motivated before, I hope you're motivated now. I am here. Are you here? Let's say it again. I am here. I am here. I am here. Thank you, Chanel, for that. That was absolutely phenomenal. I just told her this was my first time actually hearing her on the mic. We've been in spaces together before, but this was my first time fully seeing her in her element, and it was phenomenal. And I'm grateful. I'm grateful for you, sis, for leading the charge, for being a shining example, for doing the work, for showing us that a mom of 6 who just got simply motivated by her own experience could literally help to change the landscape internationally in maternal and child health. So anybody, that means we all have the power, we all have the ability, we all have what we need to make positive and lasting changes. Your voice reminds us that when we uplift stories and experiences, we spark advocacy. And when advocacy meets action, we make change. Now, we're a little bit ahead of time. You ever been to a conference where you're a little ahead of time? Come on, okay, we'll give y'all a few minutes back. We are gonna be going to a break, and then after the break will be the breakout sessions, our first round of breakout sessions. Each of our breakout sessions today will be offering a unique lens on improving maternal and child health. So for this first round of breakouts, we have right here in the Grand Ballroom, preconception care and beyond, empowering providers to support healthier pregnancies with Dr. Kathleen Green. That will be right here in this room. If you're gonna do that session after the break when you come back in, please come forward. This is a room for 500. It's not gonna be 500 people in here, and I'm sure that Dr. Green doesn't wanna talk to you at the back of the room, so please move forward during that presentation. In meeting rooms 1 through 4, which is in which direction, somebody? Help me. Which is straight across. Meeting rooms 1 through 4 straight across will have self-measured blood pressure implementation in MCH, a path to empowerment and equity, with Kim Gifford from the Preeclampsia Foundation. I think the Preeclampsia Foundation knows a lot about blood pressures. Definitely check that out. And then in ballroom D and H, which is out to your left, D through H, behavioral health care is essential for maternal and child health with Dr. Andrew Magliacio from Memorial Healthcare Systems. Don't forget, if you want your CEUs, wait for the QR code to do your survey. You'll be able to access that code, and if you have any questions, look for a staff. We also will invite you during the breaks to visit with the exhibitor tables out there. Sister Midwife Productions actually has an exhibitor table, and I didn't mention this. One of the other great things that I love about Chanel is, in that we've shadowed each other, is we both have partnerships with Baby Dove, and so what we have is a Black doula directory. If you are serving families and they are looking for doulas, Chanel talked about doulas, we know we have doulas in the room, please check out the Black doula directory. It is free to search, it is free to get listed, and it is also providing access to doulas that people don't even know it might exist in their community. So if you're a doula in the room and you're not listed, make sure that you get listed, and we have some information about that at our exhibitor table. Let's see, I think that's almost it. So you're gonna leave out of here, you're gonna take a break, you're gonna get some water, you're gonna use the restroom, you're gonna freshen up, and then you are going to go to your breakout sessions, which will start at 10:30. After your breakout sessions, you will have more time in the exhibit hall, and we will meet back here at noon for lunch. Y'all got it? Questions? No? I'll see you at lunch.